over 70 multi-speciality hospitals, more than 3,000 pharmacies, a network of over 200 clinics across India and overseas. Apollo Hospitals, the first corporate healthcare provider in India. With a robust presence across the healthcare ecosystem, Apollo has touched over 120 million lives since its inception in 1983, providing leadership and direction to Asia's foremost integrated healthcare body is Dr. Preetha Reddy, the Vice Chairperson of Apollo Hospitals. A key voice in India's healthcare policies, the President of the Healthcare Federation of India, and the Healthcare Personality of the Year 2020.
Welcome to Billion Dollar Idea. We're delighted to have you here.
Thank you. It's an honor to be on the show.
Well, thank you very much. We want to really talk about your journey as a business leader. And while people like me or people of our generation were busy playing doctors and nurses in our homes, you were, of course, working with your father, doing the real thing from a very young age. What was that like?
I always wanted to be a doctor from a very young age. So I did also play at being a doctor, wear a white coat, carry a steth around. But it so happened that, in India, young girls get married very young. And I didn't go to medical school, but instead I pursued a degree in chemistry and did a postgraduate in the sciences. But having said that, when my father started this whole journey of providing healthcare of the highest standards within our country, we laughingly say that the four of us, my dad has 4 daughters and all of us work with him in the business, that we were cheap labor and we just wanted to help because we found him working extremely hard. And without going to business school, we really learned literally by walking around, learn from our mistakes, trying to put the best practices together, and maybe from some of the good institutions globally. And we picked up all our knowledge from literally learning from others, evolving a system which was accessible, cost-effective, and had a geographical spread in our country. So that's how it really started and evolved.
Would you say, Preetha, that having been hands-on from the youngest age, would you recommend that to budding entrepreneurs and business leaders? So, for example, for those thinking about MBAs versus practical experience, would you have a perspective on that?
I think in today's world, an MBA is a good thing to have. It's required, and we do encourage our children and the next generation to have it. But it definitely cannot replace actual experience on the floors. What you learn on the floors in any institution is very valuable. And what you learn from people with experience is extremely valuable too. And today, in an age of digitization and where learning can happen and where you can literally acquire an MBA without physically being on a campus, a mix of both, I think, would be the best going forward for future generations. So you can't really replace one with the other.
Right, and going back to where you started the journey with the family, Preetha, did you find it difficult being a family member, being involved in all of this? Did your father have particular advice to you? Did your father see the daughters, the 4 of you, in different ways?
I think it was a learning. It wasn't easy. And definitely, 4 girls coming into the business, different aspects of the business. In the beginning, it was viewed a bit with a little bit of skepticism, maybe, and to prove that you're not a housewife after all, and you really are a professional and you really mean business, you might have to work a bit harder if you're part of the promoter family. But I think gaining people's respect, working side by side with some of the best clinicians in the world has really taught us to be able to respect one another, because we bring a business point of view to what we do, and we respect the clinical work which our doctors do. And I think it's been a great journey of coexistence, of learning from one another, and really nurturing the best of both entrepreneurs.
And recognizing that you have three sisters as well, Preetha, how did you initially divide up the work? And as you've developed through the business, how have you thought about all of that? Because it's a remarkable thing that so many of you are still involved in the business and appear to have found complementary roles.
So I think for all family businesses, ours is probably, a good example. My father understood the strength of each one of us. One of my sisters is a great strategic thinker, and she's fantastic with the business aspect and the finances and strategy, and we respect that about her. Another one of my sisters, she's like the most accomplished entrepreneur with a beautiful mind, and she has started off. She's like 10 years ahead in terms of thinking of the business. My youngest sister knows, she's the one who's leading our digital transformation and has great people skills and knowledge. And I spend a lot of time with the clinicians and really building out the new projects till they get to a level where they can then get on with their, on their own steam. So I think each one of us has an intrinsic strength, which we see and which we respect with each other. And we work as equals. And when it comes to the four of us, there is really no hierarchy of one or the other. And each one has a very clear line of and a chain of command. And we run our entities. And there's a cross-learning, because I know that, if I needed to go to the banks for financing, I would always ask my sister to do it because she's way better than anyone else. And the same thing is if there was something in the hospital and if there was a new clinical program to be established, she would ask me to do it. So I think we respect each other's capabilities and strengths. And so we really, parts of a whole, we're just sums of, 4 quarters of one whole piece. And that's the way we function.
That's a wonderful thing. It's a great inspirational story, particularly for women in India. As the father of 2 daughters myself, I'll be holding them up. I'll be holding you up as a great example of them. But tell me, Preetha, when you started, could you have imagined where you are now? Did you see the business very differently when you started? Tell us a little bit about the evolution and how things have changed for you and the family.
So when we started, it was my father. He came back to India. He was, a successful cardiologist in the US. And his father wrote to him and said, it doesn't matter to me or anyone in my village if you're so successful in the US, because you will just be a name. So my father packed up immediately. Maybe in a month, he was ready to come. So 1 wife, 4 daughters, a car and a washing machine. And that's all he had. And he moved back to India. And when he came, he set up his first clinic in the city of Chennai and had a very successful practice, because there was this very handsome young doctor who's moved back from the US. So I think his clientele and his practice really grew, and he is a fantastic clinician even today. And having said that, there was a time when he could not send his patient to the US for treatment in time because there was visas, and there was, of course, the cost of funding the treatment. And then he said, we really need to do something in our own country. And that's how Apollo really evolved. It evolved as one hospital, which would really be the best in cardiology. And by the time we really opened our doors, we had the best clinicians in every aspect. So it was, we had the orthopedics and the nephrology and all the teams coming together, doctors moving back from the US wanting to be part of this dream. And as we started in Chennai, Hyderabad happened almost simultaneously. And then it was all about the hospitals all over the country. And we found that patients from the neighboring countries were coming to us for healthcare. At that point, it was my sister who, she literally dared to dream like my father and started the whole retail pharmacy chain. So that has grown into a large enterprise by itself. And we were the first to do health insurance. which then we sold to put into a large platform of digitization. So in every aspect, I think, we've taken the next level. We started with hospitals. We moved to really building a network of clinics, hospitals, pharmacies across the country. And now the next transformation at Apollo is really building its whole digital backbone and having, we've treated over 20 million patients. So, now we understand that if we really digitize and we can reach people literally, at their palm tops, I think it's going to be the next wave of Apollo, and that's the way we're scaling up. So we never stop, and we keep doing different things. We were the first ones for Southeast Asia. We've set up a large cancer facility, bringing the proton beam therapy, which is again the first of its kind in this part of the world. And we know that it will make a difference in the way cancer treatment is done. And we work with some of the best centers globally for research, monitoring outcomes, bringing the latest technologies, the latest interventions to our own country so that, everyone here benefits. And all this happens at 1/10 of the cost. So for us, our ethos is a AAA rating. The first A, of course, is to provide access. The second A is to be affordable, and the third A is to be accountable. So I think that's the underlying philosophy on the way we function in our businesses.
And it's an incredible story, Preetha. As we try and tie this story back to the thoughts and dreams and ambitions of aspiring entrepreneurs and business builders, when you look at your story, how much of it has been by design? How much has been by accident? What are the things that have surprised you, and what lessons can you offer out to people that are looking at you thinking, "Gosh, I'd like to be Preetha Reddy one day"?
Okay, let me be honest. It did not happen by design. It happened to some extent by maybe serendipity or accident, because when my father started this, I was married and I had 2 children, and it was my younger sisters who really worked with him to get this going. And then 2 of my sisters got married and moved to Hyderabad, and I was the last one in the family to actually come into the family business. So it really did not happen by design at all. It just happened because we realized that the more hands from the family who will help grow the business and be there 24/7 will really, make it more successful, I guess. But it was all about just being there and caring for the patients. And that's the way we learned and we grew. So I would very honestly say that, we really didn't plan or design for it to be on this scale or this large. But I think it's the confidence and trust which, number one, is, the patients and their families have with us. The second is all our staff and our clinical teams who are again part of the enterprise. And the third is those who invest with us, whether it's the banks or the shareholders. So I think the trust factor is really what has helped us build it to this size and this scale. My sister, raised a QIP just about a week ago. And she said that the underwriting of the amount for the QIP, even though we really, wanted to raise just about 150 million US, it was over 2 billion. So we said, wow, which shows that, people really trust us and the way we do things. And I think that has been very heartening and has given us maybe space to dream and challenge ourselves even further.
So, Preetha, awesome business. Congratulations on the fundraising result. For you as a person, and again, thinking about those who want to follow in your footsteps, how have you developed? When you left home with your 2 children and went to work, are you a different person now? How have you developed as a person? Do your family see you the same way?
Well, I guess you have to ask them, but I think one aspect is that, we really have learned to take a lot of things with equanimity. And I've also realized that, whatever seems like a big problem, is actually not that big. And I'll give you an example, and this is probably my management lesson for people, is that when a manager or a very senior person comes into the room and they're very bothered about something which has happened or what someone has said, and if you tell them to walk just a few feet away from the corner office, and you see people who are lying there whose problems are just so much bigger and so much larger, you realize that we really have to be grateful for what we have. And if we are out there to really make the world a healthier and a better place, we can achieve so much more, because literally it's not about myself at all. And I feel that every day, and I think I felt that even when I was younger, because it wasn't about myself. It was like wanting to go and help my dad and to reduce the burden which was on him in terms of work. And then I enjoyed what I did and I loved what I did, and it grew as a person. And we realized that every day there is so much more to do and so much more to give. So it's about not about me at all.
And Preetha, so you come across and a lot of your philosophy is sort of supercomposed. Are there things that rattle you? When do you find yourself under pressure, and do you get stressed out?
Yes, I think so. And if you ask my team, they would say that a lot of the stress comes when we as a country really feel that healthcare is very important. And a lot of the stress comes if we really can't get policies which will help, really grow the healthcare space. Sometimes the policies are not really very favorable to growth. It's not favorable for healthcare to be an infrastructure. And that kind of, it worries me and it saddens me, because I think we are here to provide healthcare of the highest standard. So I think sometimes policies do bother me. At work, if things don't go right, accidents can prove very expensive. And if we don't plan ahead and we don't, we're not like completely sharp and clear in terms of quality and in terms of our interventions, then it's a very costly mistake, because we're talking about people's lives. And so if people are slipshod or careless or, not really precise or perfect in their thinking or in their way of carrying themselves and doing what they have to do, it really rattles me.
No, okay. So, and now turning to the market which you now dominate, India itself. How do you see the business landscape, Preetha? And do you think, and here's a question for you, do you think in any way that being an entrepreneur in India or a business leader in India is any more or less difficult than other markets? Do you think the entrepreneurs we have here are any more or less entrepreneurial? Tell us some of your thoughts on that.
I think Indians by nature are extremely hardworking. So that is definitely a given. To be entrepreneurial, you have to take risks. We have learned to take risks now, because I think by nature we are a bit risk averse. And that is changing with the next generation and with the younger generation. What would be nice is if we had more policies which are favorable to businesses growing, because at the end of the day, when the economics of a nation flourish, then everything else flourishes. There are more jobs, there's more prosperity, and I think we need to be able to create a more favorable environment for businesses to grow and flourish. And to create a favorable environment, there has to be trust and there has to be accountability. And that should come in. And I think now by digitization and things actually becoming more automatic, payments just going online, the level of accountability and all that is improved. And I think it's going to be a great country to be in and to work in for the next generations.
And Preetha, if you were building the wonderful enterprise that is Apollo Hospitals, would you rather, looking back, have built it in a place like China or in India?
India for sure. We're the largest English-speaking population in the world. And we're the most cosmopolitan, so definitely, and it feels safer.
Possibly room for improvement, as you say, on the regulatory environment and lots of opportunity on that front.
Yeah, I admire that, China is a country for the discipline and the fact that, if there is a product, it can be scaled, it can be developed, it can be designed, and it can be done really quickly. But I think India, we can do the same thing. We just have to focus and work much harder.
Thank you, Preetha. And when just turning back to yourself and your own personal inspirations, obviously your father was a guiding light in all of this. But when you look across the world of business, or frankly the world of arts or music or anything like that, who are your inspirations? Who's inspired you?
My father inspires me a lot because even at 87, he continues to think 10 years ahead, and he always has a solution for a problem. And having worked closely with me, I think he's our greatest inspiration. My mother for, keeping the family together and telling us that we need to work harder, be independent, and just for her love and her eye for the most beautiful things. I love art and I love design. There is not one particular artist I would say that, I love and admire. I also went to a dance school in my younger days and did a post-graduation in classical dancing. And that was started by a lady called Rukmani Devi Arundale. And I was lucky enough to actually learn from her and watch her and see her sense of design. So at that time, she did inspire, and this is a long time ago, but she did inspire. And I think the love and the appreciation of the fine arts and of the finer things came from exposure to being with her and going to a school like that, which he started and ran.
That's a very interesting.
Love to say Elon Musk on the other side, because I think he just continues to astound and inspire a whole lot of people, not only the youngsters, but people like me too.
Where does the stamina and the drive and the imagination come from? What is his secret?
It's not about himself at all. And, I remember during our, I think, 30th anniversary, and we went and we said, we've done all this and we've grown the business and we have so many beds and so on and so forth. And he looks at us and he says, okay, now we need to see how do we keep people out of hospitals. It's fine once somebody is sick, somebody will provide healthcare and, they will get better or they won't. But how do we catch disease early? How do we keep people healthy so that they don't have to spend a lot of money and come to hospitals? So his mantra now is really all about wellness, about catching disease early, about good lifestyles, good working habits. And so the whole ethos on treating illness has moved significantly to keeping people well. And I think that has been like the most gratifying, the most exciting shift for us as a healthcare provider, that if we can really work hard to keeping the population alive, healthy and well, we would have really done the best we could, I think.
And do you think in that regard, Preetha, that actually for successful enterprises, it ought to be more about the mission and less about the money?
I think so. So, this is what I say, that we are in the business of caring. And if we get the caring right, the business will automatically follow.
That's fascinating. And just looping back to the beginning of the journey, Preetha, when you were a young woman, did you want to do other things? Was this always what you wanted to do? Are there other careers that you would have liked to have pursued?
I wanted to be a doctor from the time I was a little girl. So to me, this is the second best in a way, that I work with doctors and, I run hospitals. But I always wanted to be a doctor.
Preetha Reddy, it's the most wonderful story. Tell us one thing, just as a parting shot. When you talk to people starting out, budding entrepreneurs, budding business leaders, what are the one or two pieces of advice that you would give to them?
So I would say that nothing comes easy. You can't wave a magic wand and then suddenly have a whole business. You have to really work at it and think and plan. And having said that if the ethics and values are in the right space, the business will always blossom and grow.
Preetha Reddy, thank you so much for talking to Billion Dollar Idea. Good luck with your enterprise. Regards to your father, and thank you very much for spending time with us.
Thank you. It's a pleasure being with you today. Thank you.
Billion Dollar Idea.
Co-powered by Citron. Inspired by you.